And in the ear, you have an area where the crystals live. That's called your otoconia. Remember we talked about that a long time ago, right? So in the past, you were positive in the posterior canal, which is the more common of the canals to be affected. However, with treatment of the posterior canal, it's not uncommon for them to go into the horizontal canal, which Steph discovered on your last appointment.
Right.
So the fact that you're still a little bit symptomatic, we're going to reassess those positions. But first, because you have a history of posterior canal involvement, she's going to check those too.
Okay.
So for the posterior canal, what would you assess? Which position?
Like a Dix-Hallpike?
Yeah, perfect. The Dix-Hallpike is the test, and then that's one where she lies you backwards, right? And what plane should the head be in?
Like extension and rotation to that affected side?
Mm-hmm. At what degree though? What degree is the
45
degrees? Perfect.
She's very good.
Yeah, no, she's great. So she's going to be checking that position, and then we'll be assessing your eyes, right? If you feel symptomatic, tell us, because sometimes what happens is with repetitive occurrence of vertigo, you'll be able to habituate a little bit, so we won't be able to see the movement of the eyes. So then we'll put the goggles on you. But if you feel symptomatic and we see it, then there's no need to put the goggles on, because it just makes it more enjoyable for you.
I can tell that this is coming from here and the top.
Mm-hmm.
I can really draw a line as to where it is. And this ear is being affected by it.
Okay. Have you noticed any changes in any other secondary symptoms since you've gotten it again?
This is probably the worst I've ever had.
Gotcha. In terms of what?
Not being able to do anything. I've been wearing a neck brace because I have one.
Gotcha.
And that helps me stabilize my head.
Mm-hmm. Gotcha.
So that I'm not moving it too fast or too,
For sure.
I'm being real cautious.
So what would be some follow-up questions you would have if someone reports that symptoms have changed or worse than they've ever been before? What kind of area would you look at to rule out?
Like other neuro testing, so like central sign.
Central causes. So what are kind of the main, what are the five Ds, right?
Yeah.
So what are those questions, and how would you assess those if you needed to?
Have you had any like double vision?
My vision's starting to be affecting it now.
In what way?
Kind of a little blurry,
Okay.
Mm-hmm.
you know.
Have you fainted since the last time you came?
No.
No. Any difficulty like articulating speech, or any difficulty more than normal like recalling words or anything like that?
No, my speech I feel is kind of different, but I think it's because my sinuses are,
Oh, okay.
I feel like I've got a sinus problem right now.
Oh, okay. Got it.
In fact, I tried to get an appointment with an ear, nose, and throat doctor and left a message for them to call me back.
Got it.
Because I think I need to get my ear checked.
Got it.
Do you get ringing in the ear at all?
No.
No?
No. It just feels plugged,
Yeah.
but nothing.
And you feel it always on that right side?
Never, ever have I felt it plugged before.
Gotcha.
This is the first time.
Okay, so you brought up dysarthria, you brought up drop attack,
Dysphagia, diplopia, and then dizziness is
dizziness,
the
yeah,
last
which
one.
she's experienced. And so with the dizziness, do you notice any dizziness outside of movement, or do you always feel the dizziness associated with your movement?
I am fine if I'm sitting down or laying down. I'm fine. It's when I get up and start moving
Gotcha.
that I'm kind of hanging on to the walls or bumping into it.
And no change in medications or anything like that
No.
since last time? Okay, cool. So, because you just saw her and you did neural exam, there's no need to go through all the neural stuff because there hasn't been any change. But let's check posterior canal first. Let's do the Dix-Hallpike, and if that's negative, then we'll do the roll test to assess what you did last time, and then see if there's any occurrence again. Okay?
All right, I'm gonna have you come sit over here.
Okay. Want me to turn it
I
around?
do, when you're ready.
I'm ready.
Go ahead and slide back towards me. A little bit more even. And actually even just a little bit more.
Yeah, go until you feel the crease in the table.
Oh,
You'll feel my
there
hand.
you
There you go.
All right.
How short I am, no wonder.
All right, so I'm gonna have you turn your head to the right. So right here, there you go. And then we're gonna start with bringing your chin down towards your chest. There you go. And then on the count of 3, you're gonna go ahead and lie back. I'm gonna support your head. Your head is going to extend. You know the drill with this, but, and then try to keep your eyes open for me, okay? Mm-hmm. And it's gonna be pretty quick, okay? 1, 2, 3. Even a little faster. There you go.
Yuckies.
Mm-hmm. Go ahead and look to the left. And then to the right.
Does any of that make it worse?
Looking that way, no.
So that's Alexander's law, right? So looking into the fast phase would increase severity of symptoms and usually subjectivity of symptoms. And then which the fast phase typically for posterior canal would be which direction here?
Up to the right.
To the right, yeah. So if you have her look to the right, go and look to your right. There you go, nothing there. And then now look to your left, which you would assume would still be negative. There you go. And then back to the middle, and I always like them to close their eyes. Go ahead and close them, and then open again. Yeah. Cool. So then now, let's sit her up again.
All right, you ready?
Uh-huh.
Did the dizziness go away?
Yeah,
Yeah. How long do you think that lasted?
not very long.
Okay.
Yes, the one thing I'd say is speed, right?
Right.
So because she reported some symptoms there, but you didn't see anything, I would increase speed. So the one thing I like doing for posterior canal is actually being the front. The back side is if you're going to do treatment. So go ahead and cross your arms across your chest, if you would, Liz. And then now I'm here like this. Okay, so from this position, we're going to go down quickly. Ready? 1, 2, 3. Eyes on me.
Yeah, pretty eyes.
You too. Now look to your right. Yeah. And then back to me. You feel okay there, Liz? Yeah?
Yeah, a little
Little what?
funny.
Yeah. And then now let's sit up and then look straight ahead. You always want to make sure you're checking upon return too, because it's an exhalatory position forward. So I didn't see anything, but that's a dramatic position. So let's assess the left side now.
Okay.
And yeah, do it from the front.
All right, go ahead and keep your arms crossed over your
sorry.
chest.
There you go. Hold her
That's okay.
45, then extend a little bit, and then now back.
And then we're going to go ahead and lie back pretty quickly, okay?
Oh,
Dizzy?
yeah.
Go and look to the left for me. Is it still going on?
Mm-hmm.
Go and look to the right. And then look back at me. And then close your eyes for me. And then open.
So what do you not notice in that?
That like the torsional.
There's no torsion. It's horizontal. So she's going to be positive because the acceleration of the movement, but that's not posterior canal. So then let's have her, bring her into neutral. Let's sit her up. Look straight ahead. Yeah. Okay. So now let's assess roll tests, and I'd like to see it on the left.
On the left?
Do you want me to fold my arm?
No.
Oh,
go
you can
ahead and
relax
sit
now.
forward a little bit for me.
So what position is the horizontal canal anatomically?
15 degrees, like flexed, or
30 degrees.
30 degrees.
Extended. So then you bring them into 30 degrees of
Flexion.
flexion to put them in plane.
Got it.
So I saw you tilt the table, which is what you want, but let's put a pillow too so it's comfortable for her neck. And then let's assess left side roll test. So go ahead and now just comfortably lie on your back there, if you would, Liz, and just have your shoulders off the pillow. So scoot down just a little bit. There you go, and then let it relax.
Oh, okay.
Okay, so with roll test, you're going to be rolling their head in the horizontal plane. So I like the same hand hold where I'm on top and then rolling, and I move with them. So then that movement of me with them controls the speed, right? So I'm not just doing it with my arms. So let's do and you want to be in front of them. There you go.
Okay.
So now from that position, let's check.
I'm just turning your head.
Oh,
That's all.
okay.
Okay.
Yeah.
And then ready? Go ahead and just relax. I'm going to turn you to the left, okay?
There you go.
Nothing? You feeling anything?
Mm-mm.
Okay.
Now look to your right. And then look to your left. Good, and back to the middle. Okay, so that looked good. So if it were to be beating downward, what would that tell you?
The geotropic, like left-sided problem.
Which would be most likely canalithiasis, correct? And then if it was beating upward, that would be, agiotropic.
Yeah.
So horizontal canal, you always want to assess both sides. So she was positive on the right that was Friday?
Friday.
Friday, okay. Let's check it out. Now we're going to do the same side that she
Ready?
tested last time.
All right, just relax your head there. There you go. We're going to turn to the right, okay?
Mm-hmm.
There you go. Yeah, you see it? There's that little tick. Now look to your right. And then look to your left. Good, back to the middle. Do you feel dizzy there at all, Liz?
A little.
Yeah, I think we need the goggles for her. And then go ahead and close them there, Liz. And then open. It's super subtle, but you see it. Good, now go back to the middle. Here, I'm gonna grab the goggles.
Okay.
I'm gonna squeeze by. I'm gonna grab the goggles real quick.
What do the goggles do?
So it's,
Let you see it better?
well, yes, but it stops you
Hey,
from
Nate,
being
could you
able
do me
to
a favor?
fixate
Can
on
you
a
see
certain
if,
point. Because
if,
sometimes we can stop that
next
nystagmus
one
if
is
you're
here.
really focused on a point
I
ahead
just
of you.
forgot her name.
And what this does is that
Um,
limits your ability to focus
Patty.
on something out in front,
Yeah,
so
and
your
then if
eyes
Patty's here, if
can't
we could put her
focus
on
on
mute,
anything,
yeah.
so they will move a little bit more freely if there is nystagmus.
A little chicken
Yeah.
teriyaki.
They look really, really funny, but it makes your eyes look
Or is that
really
your
big.
bento box?
But it allows us to see that movement really clearly. Yeah.
Oh, there you go.
I feel special, I get
No.
to you.
Yeah.
Must be over here.
That's the idea.
Five days in the house.
Because you're an
Hey, do
active
you know where the goggles are?
person, right? Oh yeah, you're always.
Oh, yeah. Nope, this isn't them.
An hour and a half.
What's that?
Can I go back to Tappa?
Not today. No. I would assume you would be good to go by Monday. But because your symptoms were this Thursday,
God.
I would say
No.
probably wait till Monday. No, because it would be, how much of it would be looking down or up or turning your
Have you
head?
seen the
or-
goggles?
Yeah, I would wait until Monday.
Of course, the one time I need them with him recording.
I will be
Can't. Oh, here we go. Boom.
Pretty brave, Mom.
no line dancing either.
No, not yet.
No line dancing or no tap.
Okay, here you go. Sorry, it took so. Okay, so the goggles are a way for us to see into your eyes, but you can't see out. So you can't fixate on any sort of a point. So it may make you feel a little bit more symptomatic, but it'll allow us to
Do you
see.
see this? but hold on, let me turn that on.
Yeah, there you go.
That's what it looks like.
See how we can see your eyes? It magnifies your eyes.
Yeah.
Okay, so let's do the right side roll test and the left side roll test. And then if those
Wanna
are
lift your
still
head up for
negative,
me?
we'll reassess the posterior
There you
canal.
go. And then go ahead and put that in a comfortable spot on your face for me. Oh, you can bring them up a little bit if that's more comfortable. There you go.
Thank you.
Yeah.
Yes, that's better.
Okay. I'm going to turn them on. Ready?
Okay.
There we go. Okay, let's do this
Are my
right
eyes
side.
bigger?
Yeah.
To us, yeah.
Are they greener?
Hey Joe.
No.
Sorry. Patty, she's not here, right?
Mm-mm.
And 0. Okay, I'll give her a call.
Okay, you ready?
All right.
So now she's going to rotate your head. Ready?
Which way are we going?
I'm going to the right, okay?
Yeah.
1, 2. Just relax your head for me. 1, 2, 3.
Good. Now let's have her look. What position was she positive last time? Here?
Yeah.
Was it ageotropic or geotropic?
Geotropic.
So let's have her look down then.
Look to the right for me.
Yeah, that doesn't look bad. You feel symptomatic there, Liz?
It's a little, not much.
Yeah. Back
then
to the
to the-
middle.
I'm sorry.
Go ahead, back to the middle.
And then let's have her look up.
Look to the left.
Good, and then to the middle. Go ahead and bring it back to the middle. How you doing there, Liz?
Fine.
I mean, there's a subtle look to your right again. Yeah, but that doesn't change the rate of it. So go ahead back to the middle and relax, and let's see the other side. I would say that that's still negative, because sometimes, or not sometimes, you'll have in-range nystagmus when they're looking all the way to their
So,
end
yeah.
of range, but she doesn't report any change in her symptom.
Right.
All right, now we're going to do your left.
Okay.
All right, ready? Anything there?
Yeah, that doesn't look bad.
We go and look to the right. Then to the middle. And then to the left.
A little bit.
What do you feel there? Do you feel any spinning, or do you just feel dizzy?
No, I just feel weird.
Yeah, because you're not, there's no nystagmus. And then back to the middle. Now close your eyes, Liz. And then open. Yeah. So the only subjective position she was really symptomatic was left posterior. So let's reassess that one
Okay.
and see what that looks like.
Go ahead and sit up for me.
You doing okay, Liz?
Yeah.
Was there any movement upon return? No.
All right, I'm going to have you slide back about a foot, okay?
Yeah, you'll feel my hand. Keep coming. A little bit more. There you go. Well done.
All right, we're going to do the one where we tip your head back to the left, okay?
Okay.
So I'm going to have you turn here for me.
You relax your arms. There you go.
Well, put them on the chest.
There you go.
All right, on the count of 3, we're going to lie down pretty quick, okay?
Okay.
1, 2, 3.
Oh, yike.
Yeah.
Now I feel it.
Yeah. I can't see.
Still there.
It's
Is it left posterior now? Are you still feeling symptomatic?
A little bit.
So if you're assuming so, what position would you have her look?
to the left.
Now look to your left, Liz. Does that make it worse?
Yeah, I feel it up like up on the top of my head.
Yeah. Now if you look to your right, does that change it? Better, worse, the same?
It's better.
Yeah. So there's your Alexander's Law, right? So it's your left posterior canal. The torsion is a little confusing because you don't see it too much, but it must be early
Yeah. Go and look to the left.
Yeah, I just can't see. Good. And then let's sit her up, give her a little respite. Let's explain Dix-Hallpike to her. Or, sorry, the Epley's maneuver, which she's had before. Here, I'll grab it. And then we'll treat it. So, left posterior canal, right? We would assume. Confirmed it with Alexander's law, based off of subjectivity and the increase in her nystagmus. So now we'll do the treatment for it, which we've done before.
Yeah.
And then review the precautions for her so that she, tries to maintain the correction.
Yeah.
Sounds like you're wearing the neck brace. Yeah. Do you
it
feel?
helps.
Yeah.
Well, what it does is it keeps me from moving my head quickly in any direction.
Yeah. So, ideally 24 to 48 hours of a limited position, but you don't want to have them so limited that it starts to create secondary symptoms in her neck. Because you need normalized movement in the neck too, right? So today is Monday, Tuesday, today is Tuesday, that's right. So we'll reconvene probably Friday and see how you feel after she does the treatment on you.
Okay.
Right?
Sounds good.
Okay. So for the Epley's maneuver, test position 1 is position A, and then move you to the right, same
side.
plane of movement, 45 degrees. And the key is to end up on
Your
right
side.
shoulder, nose down towards.
Because right now I feel woozy.
Yeah. Yeah, because we just threw you around a little bit, unfortunately.
A little bit.
Yeah. So the key then is when you're doing the treatment is to give yourself room for the right sideline. She's so petite, it's not a big deal, but let's still have her slide more to the left side of the table.
Okay.
So go ahead and move your tush over just a little bit. There we go. So then we didn't count, but we should have counted the length of time for the nystagmus. Let's assume it was like 15 to 20 seconds.
Yeah.
So in terms of treatment, you want to add that on top of a minute of the position. So a minute plus the 15. You could, because you're doing test position 1, let's count it, and then we'll add that duration to the treatment as we go through each position.
Okay.
Okay?
Ready?
So now she's going to be behind you, so she's going to support the head.
Okay, so where are we going?
You're going to turn to the left for me here,
Okay.
and then we're going to lie down pretty quickly. That same thing that we just did with the goggles on, but this time I'm just behind you, okay?
Okay.
On the count of 3.
Without goggles.
Yeah.
No
without
goggles,
them.
yeah.
All right, you ready? 1, 2, 3.
Yeah, see, there it goes, yeah.
Tell me when it goes away.
It's getting better, but
Yeah, I
I
can
still
see.
feel it.
Yeah, I'm not seeing the beating. Is it better now?
It's a little better.
Sorry.
You're good.
Yeah, that looks like it's suppressed. Now, she still may feel a little bit, but the beating is gone. So that was actually about a minute. So let's hold it another minute now. Here, I'll start the timer. And then that means each position will be a 2-minute hold.
Yeah.
You doing okay?
I know it's a really fun position to be in for a
It's
long
all
time.
right. It's worth it.
When did you notice it start to come back again after the last treatment?
Wow. When I got home.
Oh, you started to feel it right away?
Oh, yeah.
That was on Friday you saw her? You got 20 seconds.
Then the next position is going to be still lying on your back, but I'm going to turn your head to the right, okay?
Okay.
So the key with that is to make sure you're maintaining extension. Go ahead. Extend, good, very nice.
A little dizzy.
So just give it a little 45, a little less. There we go. Doing all right? She's gonna mess up your hair real good.
I know, I thought about that. Don't know why I
No
brushed
hot
it.
date tonight?
Nope, darn it. No, I'm just kidding.
And then I'm done at 2 on Friday. So we gotta figure out for her scheduling, like when to come back.
Oh yeah, I could check her out. Got 30 seconds.
We're doing good.
Yeah. You doing okay?
Yeah. The next position is going to be still having your head turned to the right. We're going to lie on your right side. So
Okay.
it's going to end up with your nose kind of facing down towards the ground, okay?
Got it.
Yep, and then just make sure you maintain extension too.
You ready? Okay, go ahead.
go
and
and bend
turn
your
without
knees.
moving your head for me.
There you go. Now go ahead from this position, roll onto your right side. Okay, 1, 2, and 3. There you go.
You okay there?
And just
Don't let them fall off.
Do you feel symptomatic here at all? A little dizzy?
Yeah, a little bit.
So position 1 and 3 should be symptomatic. 3 because it's like the slide going back to the utricle. So I was always taught if position 3, if they were positive in position 1 and position 3 is asymptomatic, you probably messed up on the plane. So I would redo it. But in this case, because she's feeling it, because you can't see your eyes, but then you would,
I feel
You
it
would do
up
it
at
again.
the top of my head.
yeah, where you were feeling it, what you were talking about earlier. Do you get headaches, Liz?
No,
No? Does it feel like a headache? Or does it just feel like that fullness you were talking about?
no, it's just maybe the pressure.
And then, were you able to get in touch with the ENT, or are you waiting for that call to check your ear?
No, I'm waiting for the call.
Okay. Let's see here. You got about 40 seconds.
Makes me kind of woozy.
Yeah. Okay, so now you're gonna drop your feet here, Liz. You're gonna push through that right elbow. So let them drop, let them drop. Push through that right elbow. And we're gonna sit up slow. There we go.
God.
Now look straight ahead. Here, straighten out your feet. There we go. And then we'll pull this up. There you go. Now go ahead and sit back against there. There we go. Do you want this pillow under your legs?
Sure.
And then you'll just give her a rest. I usually like to have them sit for about 10. And then we could reassess.
Okay.
Cool? So just relax here. I'll close the lights.
Yeah, it's kind of woozy.
You feeling a little woozy? Let's see. Look at my nose. Yeah. No, there's no movement. Look to your left. Good. And then to your right. Good. And then back to me. Yeah. It was probably just the change of position. You feeling better from that? Like the wooziness is getting better? Good. Here, I'll close it now. Ready?